Welcome to Med in 5. The goal of this channel is to simplify medical concepts and help you understand them quickly. This video is part of our vitamin series, and today, we're diving deep into vitamin D, a nutrient essential for bone health, immunity, and more. Before we begin, think about these 3 critical questions. How does the body obtain vitamin D? What happens if you don't get enough vitamin D? Can you get too much vitamin D? We'll answer these questions by the end of the video, so keep watching. Let's get started. What is vitamin D, and why do you need it? Vitamin D is a fat-soluble nutrient your body needs to function properly. It's crucial for calcium absorption, which helps keep bones and teeth strong. Besides its pivotal role in bone health, this vitamin also supports immune function and muscle strength and helps regulate inflammation. Without enough vitamin D, the body can't absorb calcium effectively, leading to potential bone-related problems. Here's a fun fact about this vitamin. Vitamin D-based medications like calcipotriene and calcitol benefit the skin because these derivatives help regulate cell growth, reduce inflammation, and boost the skin's immune function. These drugs are especially helpful for conditions like psoriasis, eczema, and acne. They can even support the skin's defense against UV damage and skin cancer while promoting overall skin health. How does your body get vitamin D? There are 3 primary ways the body gets vitamin D. 1. Sunlight. Exposure to UV rays from sunlight, for example, triggers vitamin D synthesis in the skin. 2. Diet. Edibles like egg yolks, fortified dairy products, and fatty fish such as salmon are abundant sources of vitamin D. 3. Supplements. For people who can't get enough through sun exposure or food intake, vitamin D supplements are an option. How is vitamin D metabolized in the body? Vitamin D metabolism starts when the skin produces vitamin D3, also known as cholecalciferol, after sunlight exposure. It's then converted, in 2 stages, first in the liver to 25-hydroxyvitamin D, aka calcidiol, and then in the kidneys to 1,25-dihydroxyvitamin D, also called calcitriol. Calcitriol is the active form that regulates calcium absorption in the small intestine. If the liver or kidneys are impaired, the body may struggle to produce active vitamin D. Meanwhile, digestive conditions like Crohn's disease can hinder calcium absorption. What happens if you don't get enough vitamin D? Vitamin D insufficiency can reduce calcium absorption, leading to weak bones. In children, low vitamin D can cause rickets, a disease that results in bone deformities. For adults, insufficiency can lead to osteomalacia, a disorder where the bones become soft and fragile. People at greater risk of vitamin D deficiency include individuals with darker skin, those with limited sun exposure, and older adults, whose skin becomes less efficient at producing this vitamin as they age and may not take enough in the diet. Regular sunscreen use can also lower vitamin D synthesis by blocking UV rays, but you can still maintain healthy levels through supplements and a vitamin D-rich diet. Since vitamin D is processed in different organs, supplementation with specific forms may be needed when any stage of its metabolism is disrupted. For example, patients with severe kidney dysfunction may require calcitriol injections, which bypass kidney activation of vitamin D, to help maintain healthy calcium levels and support bone health. Can you get too much vitamin D? Yes, although it's rare, excessive intake of vitamin D, usually from supplements, can lead to toxicity. Hypervitaminosis D can cause symptoms like nausea, vomiting, and, in severe cases, kidney damage. The reason for this is that too much vitamin D raises blood calcium levels, producing a condition called hypercalcemia. Excess calcium can crystallize in the kidneys to form kidney stones. Let's revisit the 3 critical questions we asked at the start of this video. How does the body obtain vitamin D? Answer: through sun exposure, food, and supplements. What happens if you don't get enough vitamin D? Answer: you could develop bone issues like rickets or osteomalacia. Can you get too much vitamin D? Answer: yes. Excessive amounts can lead to toxicity and calcium buildup in the blood. Did you get all the answers right? Neat! If this video helped you understand vitamin D, don't forget to like, share, and subscribe. For more content, check out our next video on another essential vitamin. See you next time.